Oh. First piece of troubleshooting is turn the right button on. Step one. Thank you, Councilwoman Johnston. Okay, now we're going to do a countdown. 5, 4, 3, 2, 1. Good afternoon. Today is Wednesday, August the 17th. I'm Erin Evans. This is the Public Health and Safety Committee special called meeting about the Department of Emergency Communications. Director Stephen Martini is here, and he is going to kick us off with a presentation, and then we'll take questions from our committee members and anyone else who would like to ask them. So Director Martini, you should be on.
Great. I think so. Yes, ma'am. Thank you, Chair Evans. I appreciate that. And thank you, council members who are in attendance today and those who are on the way. I appreciate the opportunity to talk about what the Department of Emergency Communications is doing, what we should be doing, and getting feedback from obviously this group about how we're meeting those expectations and opportunities to do differently moving forward. Just briefly to talk about specifically our non-emergency response process, I wanted to take a moment to describe the challenge. Since 2011, cell phone ownership, according to Pew Research, has moved among adults from 35% to 97%. If we apply that reality to Davidson County, we had 159,000 adults with cell phones in 2011, and now we've moved to 502,000 adults, which is an increase of 343,000 devices, basically, right? 159,000 is 35% of the population then in 2011, and now 97% of the population is 502,000. So we've increased the number of possibilities and ways somebody could call either 911 or our non-emergency number. And we've done that without increasing actual property owners and taxpayers. That's not an increase in population, it's an increase in devices in the hands and pockets of people who call. So 10 years ago, if somebody were to see something and make a phone call, often while they were on the road, 65% of people would have to wait till they got home or to their business and make that phone call. Now it's as quick as reaching into your pocket or having it in your hand and making that call. From 2011 to 2021, that same time period, we increased staff by 20 positions, and half of those were committed to administrative or support staff roles, additional supervisors, quality assurance positions, those types of roles. So in that same period of an increase of 343,000 cell phone devices, ways to call us, we increased the potential call answerers by 10 positions. That's through 2021. Obviously, we've had, thanks to this body, approval of 40 additional positions that was effective last month, and we're actively recruiting to fill those now. Kind of mentioned that, right? That same comment that says most calls came from landlines, and now it's in the hands and pockets of every visitor and resident to Nashville. How do we meet that expectation when somebody says I can call and contact and report a concern right now? What are the various ways that we can meet those conversations? So I'd like to talk about that. One thing that we can't separate in this conversation is 911 from 8600. Sometimes it's confusing to know what's happening up on the hill there behind Belmont. In a room with no windows. Our 911 dispatchers are the exact same people who are answering the non-emergency line. So there's not a way that we can have a separate conversation that says, how are we handling 911? And then let's talk separately about the 8600 line. They're the same people. So if we answer one fast, by default, we have to answer the other one slower. There's a look at the total 911 calls over the past 8 years. We really have not had, minus a few kind of exceptional spikes in the summer of 2015 and then again the summer of 2019, we've not had an incredible increase in 911 calls. It's ranged somewhere in the area of 6,000 to 10,000 calls, 911 calls a week, somewhere in the 32,000 to 42,000 range. That is consistent for 911 for the last 8 years. We have had, and then you look at the call answer times. We have national standards that dictate how quickly we need to be answering those 911 calls. In early 2014, you can see the standard says we need to be answering those calls within 15 seconds 90% of the time, and within 20 seconds, 95% of the time. Those green lines represent 90 and 95%. You can see for the majority, really before 2020, we were consistently under both standards. 2020 came along, and we had a period of time where we were over both standards. And what happened is the world shut down, and our call volume decreased significantly because there weren't things happening. There were no events, there was no traffic, people were staying at home. So for the first time in really the last 8 years, we had about a 6-week period where we could really look at our data and say our call volume has finally matched our on-duty staffing, and we could say this is how much, if the call volume never went back to what it is normally, this is how many people it would take. And we were able to devise a math equation that says a ratio of available call takers to the number of incoming calls we have, and it was somewhere around 1 to 9 or so. And if it stayed there, we're happy. And we do reach those numbers usually late November through the winter time, and it stays there till maybe February, early March, and then March brings back the tornadoes and then warm weather, and then crowds, and all the things kind of fall out, and we really find ourselves more like a 1 to 15 to 1 to 18 ratio by the time we get into the warmer months. It's not sustainable, right? The more, and it's really, it moves pretty quick. If you look to a 1 to 12 or 1 to 13 ratio, we're hitting one of these metrics, but not the other. If we move to 1 to 15, 1 to 18, we're not going to hit either of them. There's just more phone calls coming in than we can possibly answer well. So we realized around October of 2020 that we needed to focus the majority of our call-taking staff, and they're the same roles. I want to say that when I say call takers and dispatchers and those things, we train everybody at the center to do everything. We don't have somebody that just answers non-emergency calls, or some that answer just 911, or some that radio, dispatch, police, fire, EMS. They do all of those roles, and those assignments vary every day. There's opportunities perhaps to explore hiring just call takers or those types of things. The problem with that is the flexibility in staffing. It's not, I won't say problem, it's just a challenge. If you have people that show up, maybe all of your call takers show up, and you've got plenty of those, but 5 or 10, especially in kind of pandemic concepts, right? If 10 of your radio dispatchers get sick, you have plenty of people to staff it, but they don't have the skill. So cross-training everybody in multiple skills is more economical and a better redundancy plan typically. However, what we need right now for sure is call takers, and that was our request through the budgeting process. If we look back at 2019 specifically, when I'm picking 2019 to say 2020 is an anomaly, the data out of 2020 is not applicable because of the so much of it was pandemic impacted. We're finding 2021 to be similar. About half of that was still impacted of coming out of COVID. So 2019 is the best year that we can go back and compare to 2022. So our 911 calls, our compliance with answering those 911 calls in 2019, which is relevant here in a minute, we talk about non-emergency calls, was not at or above the national standards of 90 or 95% at any point in any month in that. And some of those, especially in the summer months, May, June, August, we were seeing 67%, 68% compliance with answering our 911 calls as quickly as we should have been. And I'm running these dates January to August rather than the full year so that we can have the same conversation, the same first 8 months or so currently as we talk here to date. Looking at our non-emergency calls, it is not the same story for non-emergency calls. I cannot say, we've had a steady number of non-emergency calls consistently. No, we just keep getting higher and higher and higher. We had about 55,000 non-emergency calls per month in 2014. We've spiked over 65,000 this year with a little bit of a reprieve around February. But our non-emergency call volume only continues to climb over time. We don't have more people currently to answer those calls, so we have to, and I believe this is just me theorizing, but as I look at the workscape today, where employees are, what they're doing, what they want to do, and as we compete with the gig economy and the opportunity to drive Uber or Lyft or something like that for a similar compensation package that we're currently offering, at least to the younger crowd that says, I'm not interested in benefits and those things. I can hang out on mom and dad's insurance or whatever till I'm 26. It becomes challenging. We say, I don't know that we can hire our way out of this problem. Not to say that we aren't trying, and we're going to put some people into it, but if that non-emergency call volume continues to climb, I don't think we can solve it solely by hiring our way out, sir.
Is there any particular call that we're seeing increase? Is it around traffic, or is it around
A particular call type?
Yes.
Not that
For the non-emergency.
Not that we've seen. I try not to look at particular types of calls reported, only because what's reported to us and what's discovered in the field may be drastically different. So it's difficult for us to say. And I mentioned that only to say, and I think maybe you all have heard the metaphor, the story that's out here is kind of an anecdote. Somebody says somebody broke into my shed. Well, is there somebody doing it now? Well, we're going to ramp up that. Yes, they're here now. They're in the backyard to ramp up the response, even though they may not be, to cut down on the response time. So we don't change that on our side. So it's difficult for me to say it's these responses that are driving it, because those responses may vary based on what's being reported. Forgive me.
I wasn't so interested in response, but I was wondering if there's a type. Is it on the non-emergency calls? Is it traffic? Is it litter?
A lot of them are non-emergency type, but thefts, lost property, stolen property, noise complaints, roadway obstructions, those types of things that are not immediate. Somebody lost their stolen property, right?
But nothing stands out as being a bigger segment than another.
No.
Yeah, okay.
Those low acuity calls, and I think that's going to be important for what we're talking about next, is those low acuity. I don't have I'm not a victim. I don't have a suspect. I can't say this is the problem. It's that this generically happened to me and I need this report for some sort of an insurance process. So as we look at that increasing call volume, I shared some of this data. In 2019, we received 306,000 911 calls. 76% of those during that January-August timeframe were answered within 10 seconds, which is 14% shy of that national standard. If you look down at 2022, same line, we received basically the same number of calls so far, minus about 5,000 calls or so in 911, and we've answered those with an 88% compliance. That's a 12% improvement with basically the same call volume and similar staff size from 2019 to today. Our non-emergency call volume is significantly different. 497,908 calls non-emergency in 2019 through the first 8 months. 94% of those were answered within 2 minutes. We received about 40,000 less so far through this period this year, and we're answering about 58% of those within 2 minutes. And again, I'm going to kind of take back to the previous slide. We've seen a decrease, right? What is that, about 32% decrease from 2019 to today in answering our non-emergency calls, but we turned around and saw a significant improvement from 67% compliance with answering our 911 calls in 2019 to now 88%. To me, that's the number. The sign on the wall of the building where we work says emergency communications. We have to remember that 911 is our first and foremost priority, that when somebody picks up the phone and calls those 3 digits, that's the call that we want to make sure we're answering quickly and efficiently. Not to say we don't want to answer both, but if we have to choose, we're going to pick 911. So recognizing that we have an issue, and we saw that on the wall when we assessed this in fall of 2020, we realized that by prioritizing dispatchers in the room on 911 and so the majority of the call takers that are assigned to call take, the dispatchers that are assigned to call take that day, the majority of those are logged into a 911 queue only. So they're available at that moment when you call, and there's little to no delay. This week we've had 96, 98% compliance day after day after day, which is great. School's back in, things are calming down, so our folks are able to get to those calls quickly. And then we have 2 or 3 or 5, depending on the time of day and the shift in the non-emergency queue, which obviously can back up. And we saw that as a real possibility. Recognizing that, we started talking about what can we do otherwise. One of those things is a partnership with Hub Nashville, and we've worked really hard to share a solution to report either through the Hub Nashville app or through the website a variety of non-emergency, low priority, those low acuity calls like I was talking about, that if somebody, you're still stole your bike. You get home and you see your bike has been stolen out of the backyard, or there's a car that's been parked on your street for a few days and you want that checked out. All of those can be submitted through the Hub Nashville app or through the website with pictures, and that all comes to our dispatchers. It's our 911 dispatchers that are monitoring those submissions that come through the web. As they have that downtime between 911 calls, they can process those non-emergency calls into our computer-aided dispatch system and send those out for response. It's a quick way to get a response or service from the public without having to wait in a queue to talk to somebody by voice. We partnered with our Emergency Communications District Board and their marketing team to create some of these advertisements. Maybe you've seen them scrolling social media, maybe you've seen them on TV, and some of those advertisements are out there. And we'll continue that Hub It campaign that says there's a variety of low priority, low acuity items you want handled that can be addressed through the Hub Nashville app. That's been a fantastic partnership. In January of 2020, we implemented a program called Psap to Psap. This allows alarm monitoring companies to send alarms directly to our computer-aided dispatch system without a phone call, period. It takes what is usually a 2 to 3 minute phone call by voice into processing time of seconds. It comes directly into us from the alarm monitoring center, and then we can respond directly back to them. Usually one alarm call generates at least 3, if not 5 or more phone calls. They call and tell us. We ask if a key holder is responding. They'll call back with that information that says they either were or were unable to reach a responsible party for the business, and then they'll ask us to call them back with a disposition, what law enforcement or fire may have found when they got there. If we don't call, they'll call back. So all of this is removed through this process. We can have these communications directly back and forth through this interface without requiring a phone call. About 32% of our alarms we first went live in 2020 were processed this way. In 2021, that number moved to 40%, and through this month, or through this year, through July, we're at 38%, and I'm sure that'll continue to grow. So we're seeing a continued trend toward use of this solution, which again is great for us. It gets the calls into the computer system where they can be dispatched out quickly without having to tie up a dispatcher to answer that call and process that request. Sir?
If you have only 38% participation, is this a function of other companies not being plugged into the system?
That is correct. There is no cost to us, but there is a small cost to the alarm monitoring companies who participate, and some of them choose not to yet.
That might be something we can look at.
We are working with the fire marshal's office, which is great. Every time we get a phone call from a new fire alarm system that's testing, they make sure they're aware, hey, we're using this solution, it's in place here, and it continues to grow by 100 or so dispatch centers a year, I believe.
Thank you.
Thank you.
We got a question from our Vice Chair, Delisha Porterfield.
Thank you so much for the efforts that you've made to try to make improvements. Have you all considered any way to incentivize additional alarm companies to participate in this program?
We have not. I don't know what that would look like. I have not. We've made them aware. We're coordinating with them, but we have not stopped to think about what we could do to entice or motivate. My hope was that as alarm companies join, and a lot of the major alarm companies have, when you talk about the ADTs and the ADSs and those, a lot of the major alarm companies have. It's the smaller alarm companies, monitoring companies, and really a lot of those contract with a monitoring service. We'll get a phone call from a particular number that may represent 15, 18, 20 smaller alarm monitoring companies. They do the install and then they contract out with another group. So they've not found the moment where they say it's worth their time yet, but definitely we encourage it, and we're hoping that that's those who are participating are using that as a competitive edge when they advertise market, right? Your call is going to get to the dispatch center faster than maybe our competitor.
Is there a way to possibly assess that fee for those smaller companies, assess it to that one dispatch number so that each of the 15 or 18 smaller companies are not having to pay the fee? Like, is this something that may be cost prohibitive to the smaller businesses?
It may be. It's not something that we charge. It's the company that Psap to Psap protocol group that charges that fee to participate. And I would assume, this is me outside of my lane, but I would assume that's a cost that would be passed on to the customer. And I would think it would be a welcome cost. There's definitely a benefit in using that waiting instead of waiting on a voice call.
Thank you, and I have one more question. Do you mind going back a slide or two, one more slide? So with the non-emergency numbers, I know that you're showing that 58% are answered within 2 minutes. What is the average, for the other 48%, what is the average time that is taken for those calls to be answered? And I apologize if I missed that, if that was already shared.
No problem. I have that data, and let me pull it up. Average answer time for non-emergency calls so far this year through August is 3 minutes, 21 seconds.
Do you have that broken down based on shift?
I don't. I did receive that request for a week and a month and a year look. Our software that we use is specifically geared around emergency communications and emergency reporting. So there's not a lot of, if you want 911 data, I can manipulate that up, down, left, and sideways. To get this data would require, I need probably a few weeks to massage that data and pull it out, because it's an individual day look, and we'd have to compute and tabulate that.
So I don't know what the solution is, but there's definitely a disconnect between the data that you're sharing with us and the lived experience of our constituents, especially for the overnight calls. I know I myself have called 862-8600, and I've never gotten through. Maybe once I got through within 5 minutes. The majority of the time it's taken 12, 15, 20, sometimes 30 minutes, and that is the same information that I'm receiving from my constituents, to the extent that people don't want to call the non-emergency number because the wait time is so long. Like, I've been called at 1 a.m. by constituents, and I'm on hold with 862-8600 for 15, 20 minutes waiting to get someone, because the constituent has either called or texted. So there's definitely a disconnect between the 3 minutes that the data is showing, which I'm sure is an overall, my assumption would be day shift is probably, maybe, I don't know if that's fewer calls or more people, but overnight I know for sure that the lived experience of the people in the community is way longer wait time. So can you address that?
Sure, I would think you're right. If we were to take this, and I think we've had this conversation when we look back when 8600 was a challenge 5 years ago, because it's been a consistent challenge period. But when it was a challenge then, the reported number in a budget meeting then in 17 was some level of seconds, right? 30 seconds or something. And I kind of chuckled to myself and said, there's no way that's accurate, right? Because you're talking about cumulative data. Your Saturdays, your Sundays, your 2:30 in the morning to 6 o'clock in the morning when everybody's asleep, those hours skew that data. So, right, I would want to look at this data in a 10A to 10P format, because that's really the highest, is when our call volume is heaviest, is after people are really awake in the morning and before they go to bed in the evening. And I'd want to look at this data in that time frame.
Can you get that data for us, please? I understand that it may take a while, but that is something that we need to prioritize, because, again, this is a very real experience for the people in our community. It's one of the top complaints that I get when asking people, and I definitely appreciate the partnership with the Hub and making sure that we're reporting things digitally. But when we have senior citizens and I tell them go to hub.nashville.gov, not everyone is using a computer, not everyone has accessibility. So there are individuals whose only option is to call, non-emergency, or to actually call into the Hub. So we want to make their experience a pleasant one as well.
I agree, and I appreciate you bringing that up, because that's very important for me, is that we recognize that Hub Nashville, the smartphone app, the website, that is not a reality for some members of our community. And my hope is that for those that it is a reality, they take the advantage of it, and that removes them out of the queue or the wait line in front of those folks who really rely on the phone as their primary method of reaching out. If there are fewer people in line in front of you because they've opted for some of these other alternatives, then those folks who are calling that rely on the phone can get through quicker. I'm glad to pull that data.
But I want to recognize Councilman Withers next, but also to kind of tack onto that, you may speak to this a little bit later about when Councilwoman Porterfield is talking about the data. If you could also include what the abandon rate looks like for those calls as well, and included in that, because I know the times that I call, I will say I abandon every single time, because the outgoing message gets on my nerves after hearing it, for a certain period of time. And I think the one reason why I probably haven't had as many personal experiences as Councilwoman Porterfield is my commander, gave me his cell number. And so I tend to bypass it. If I really see something that I think needs to be addressed that doesn't fit into an emergency category, then I just call my commander, and he helps me kind of navigate that. So
To call your commander, sometimes my commander sends me back to 862-8600.
my commander's better than your commander.
To speak to the abandoned rate, I do not have the ability to report that now because, like I mentioned before, our software that we use to report is really geared toward emergency call handling, and there's not, and they don't report hang-ups to the non-emergency line. It's not tracked. I can tell you all day long about 911, but
I see.
So our solution to that, I'm not going to leave it at we just don't. Our solution to that is as we install an updated phone solution in this fall, part of our renovation. Again, thank this group for helping support portion of that. That will allow us to reconfigure our administrative lines more consistently with the way administrative lines are handled for the rest of Metro. That will put us onto a new reporting platform that will really treat those 10-digit lines as we'll be able to report much more thoroughly on those. And I'm looking forward to it. And it will give us much more redundancy and be able to support and manage those than what we currently do.
Okay, thanks for that information. Let me catch Councilman Withers.
Thank you so much, Chair Evans, for that. I really appreciate what Councilmember Porterfield just stated, is that for the non-emergency number, and I've been involved in neighborhood groups for many, many years now, and it used to be that people would call the East Precinct, for instance, in East Nashville, and just trying to get people used to the 862-8600 number was a lift at that time, but we do hear about, and I think Councilmember O'Connell recently tweeted that he's experienced that in some cases calling the non-emergency number, there's 20-minute hold times and things of that nature. I think having that additional data about the non-emergency number will help. One of the things that we're experiencing in a lot of our neighborhoods sometimes is with pedestrian and bike safety in regards to vehicles that are parked in a bike lane or parked, in a manner that makes it unsafe for pedestrians to use a crosswalk that might exist. We're experiencing some of that. Obviously, our police department is not staffed to respond to each of those. Most recently, the guidance that we've had kind of from Hub Nashville folks is to report it as an improperly parked vehicle, which we can do through Hub Nashville. But that is, I think, as our neighborhoods are becoming more dense, as we are encouraging people to walk and bike more, where they have vehicles that it's one thing for them driving in a manner that is unsafe, but even for just them being parked in a manner that's unsafe or might block people's driveways or things of that nature, that's becoming more and more common in a lot of our neighborhoods. And it's something that if we can get, I know NDOT's trying to work with some additional staffing resources that we make it contractual to help to do that. But we do have a number of those things where it is a concern for the community from a safety standpoint. It's not life or death, fortunately, at least at that moment, but it is a safety concern for people that are trying to move about our neighborhood safely. And so having folks wait 20 minutes to report a vehicle like that is discouraging, I guess I would say. So.
I would really, really encourage the use of Hub Nashville. There's so much more we get through that app. If you were to take a picture of that car and say, here it is, right here, this is the car that's causing me my problem, there's a variety of things we can do with it, which is also share it beyond police or fire. If there's an NDOT solution or another group that is organized to make that response, we can provide that information quickly. And like I mentioned, those Hub Nashville requests are monitored by our 911 dispatchers. So it's coming right into the center and getting dispatched out.
Well, and that's helpful, but I think for the follow-up on that, so once one of those does get reported, what then happens next if it does go to 911? What is the next step after that information is reported?
Sure. When we take it and we put it into our computer-aided dispatch system to be dispatched out, we assign the incident number or the police report number, either way, that it was either, I say they're different. Our computer-aided dispatch center has an incident number, and then there's also a case number associated for the police department. We will reply to that saying an officer was dispatched. Here's the report number for follow-up. You can call records and get the information on how that incident that you reported was handled, what was discovered.
And so at this time, though, if that were to be reported for a vehicle, in this case, it's parked in a manner that's not safe for pedestrians or other users, are we still reliant upon a police officer to be available to go out to that site to issue a ticket?
It seems, and that's a conversation that is definitely ongoing with NDOT and others to determine who is the right response for parking violations or things like that.
Yeah, I mean, because that's what I'm saying. Like, if someone were to, I mean, if you report it through Hub, you can report the make and model of the car and the license plate number, which I've done, right? But I don't know if they get like an abate letter notice that goes to them that says, hey, someone noticed that your car was parked in a bike lane or something like that. I just don't know what from an enforcement standpoint to encourage those drivers to not park in an unsafe manner. I just don't know what that is,
Sure.
Short of having a police officer or another NDOT resource to issue a citation or a warning.
We are right on the edge of my lane, and I can't tell you about enforcement. We will send the help, what happens and how it's resolved and all that, what they discover versus what was told to us. All those things are no problem.
Let me catch Councilwoman Johnston. Hang on just a second where I can find you. There we go.
Can I boot him off of this committee, please?
Yes.
So I have had so many complaints from about 911 response or just like answering the phone, which alarms me. And I get, there's so many calls coming in. There's only a certain number of people that can answer them. I understand like our capacity, but if someone's, you never know what that emergency is, right? If their house is on fire, seconds matter. If they're having a heart attack, seconds matter. And then the non-emergency as well, where they're needing some type of service. And so I don't know what the answer is, and I hate to just complain about something, but what I did want to ask, and I'd emailed you about this before, and it triggered my mind when Council Lady Evans said she was annoyed by the message. That message is unbelievably long, and I don't know that that is the appropriate time for education. When you've got somebody that's calling in that has whatever their problem is, and they're hearing the same message over and over that's really long, that I get it's important information because they could be calling or pulling up hub.nashville.gov or whatever. But I think people get really discouraged and then just to the point of anger, that constant message over and over again. And it may be better just to say, you're in the queue, we're going to get with you as soon as possible. You're in the queue, we're going to get with you as soon as possible, instead of this long diatribe. So I just wanted to see if we had looked at that, if there's a reason why it needs to be that long, or if there's...
It's about 60 seconds. I understand what you're saying. I know what you're talking about. It's about 60 seconds. I wish there may be an opportunity. I'm going to take a note to follow up my technology team. There may be an opportunity that plays once, and then you don't hear that message multiple times. I understand you saying that's frustrating. One of the limitations of that compared to what you're used to, right? If you need this information, if you need Spanish, if you need those things, press this. Don't make me listen to it. Again, because of our phone system being really focused for 911 and not built out like a traditional phone system that supports administrative lines, we're limited in our ability to put a message out there that's more complex. One of our plans that we're working through, we've vetted it with ITS, is really to point our 8600 number to the 311 number. We don't want to do it yet because we want to make sure we've staffed 311 appropriately to receive those calls. That allows us to have access to a more dynamic phone system that allows a phone tree that says if you need police, fire, emergency, emergency medical response, press 1. That's going to reach the dispatcher. If you're calling about a car parked in a bike lane or any of those other things, stay on the line. You've reached the right resource, but we're not going to tie up the dispatchers because a police truck or a police car, a fire truck, or an ambulance doesn't solve your problem. That's the solution, and we get away from the messaging you're talking about. That is a short-term annoyance, though I understand it to be a real annoyance, and I think there's ways we can edit that in the short term to a place once and then not over and over again. But our longer-term solution, hopefully, in the next handful of months, as we onboard this additional help, we will see that shift to 311 and reduce those call volumes and take that irritation away.
Thank you. I want to catch Councilwoman Gamble next, and then Councilman O'Connell, and then I want to get back on the presentation because I know you spent some time with some questions I sent you ahead of time. So let me pick up Councilwoman Gamble.
Thank you. I have also received several complaints from the community about the wait time on the messaging in order to voice a concern. So I'm happy to hear that you all are working on remedies to address that. Also, I've gotten complaints about individuals calling the 8629 emergency number to report thefts that have happened maybe even the night before. For example, a business was burglarized, and when they came in and learned it, they called the non-emergency number and to report it and to have, well, they thought that a policeman or someone would come out and take a report, but they never got a follow-up or anything to that. So I'm wondering if there is something in place where either individuals are told when they're making these non-emergency reports that someone is not coming out, that they would need to go to the precinct or do any kind of follow-up on their own so that they aren't anticipating some follow-up that never happens.
I understand what you're saying, and I think that's an important point. That's a shift in our citizen expectations, right? I can track my Amazon package all the way from where it goes through where it visits and when it arrives to me. So we've put some solutions in place already with some types of calls, lower priority calls that say we've received. You get a text message if somebody calls. You get a text message that says we have your call, and we'll let you know when an officer is en route to you. And when an officer is assigned, they'll get a text message that says, hey, an officer's on the way. Especially for low priority calls, nothing in progress, nothing where there's a life safety concern for law enforcement, but to say you called. And then that just lets them know to keep an eye out that says I need to be around the place where I told them I was going to be. There are opportunities, and we're exploring those opportunities to start most immediately with the police department and a LexisNexis traffic reporting solution that allows people to report a traffic crash online using it without talking to an officer. They still get a police report number they can take to their insurance company, those types of things. That first conversation that we're in the late stages, and it'll deploy here in the next handful of weeks, I'm sure, are the types of conversations we're having with the police department to say, how do we meet that expectation that says, I've reported this, when can I expect to see an officer, if at all? Do I need to see an officer, right? Can I handle this? And I know that, and now, again, I'm on the edge of what is my lane, but there's some community overwatch or APR, alternate police reporting type solutions where folks are making phone calls back for those reports and handling those over the phone. Those types of solutions I think we need to explore. Because I don't think, like I said previously, I don't think we can hire our way out of this problem. I think there's other solutions that can come in. And I think people are very used to interacting with their phone to receive some resolution to some, that we can need to take advantage of some of that.
All right, thank you. Let me recognize Councilmember O'Connell.
Thank you, Madam Chair. Thank you, Director Martini. Really appreciate the opportunity to have this interaction. I think this is important. So, and I apologize. I had to pick up my daughter on the way here, so I was trying to listen in the car, and I just want to go back to something I think I heard. I was literally walking in the building when you all were talking about the call types. So I want to go back to that. Am I understanding correctly that we don't have data on the fundamental nature of the calls? Like, it'd be hard to create a graph of what the actual, like what the calls are. I know you mentioned kind of the generic.
It would be hard. It wouldn't be impossible. It would take some time. I could pull, and if it would be very helpful if we were looking at certain times. So like the month and date ranges that we talked about today, if we were to look at that, I could pull the types of calls that were reported via phone calls to 8600 versus calls to 911 versus calls we've received via hub, for example. Okay. Now, my caveat to that statement is what is reported to us versus what is found by the responders when they respond may be drastically different. And that's not a Metro Nashville issue. In 18 years of doing this has been true everywhere, because sometimes you say, if I heighten the immediacy of it or the urgency of it, I'll get a faster response.
Right. If I report my house is on fire and it turns out I could smell smoke.
Right.
Okay.
Right.
And I appreciate that. I guess I would be a little interested in, is there anywhere that does a reconciliation effort? Because I think you do want to kind of understand that too, right? It's like, how do you do the communication about it? Because you don't want to create we don't ultimately, and I have another point on this in just a second, but I think we don't want to be in a place where people are saying my house is on fire, but it turns out something just smelled a little bit like smoke as a regular act of how they interact with this, right? Like we'd like to diminish the number of scenarios that happens. And so it would be interesting to be able to learn how many of the calls kind of have maybe a not authentic nature for their escalation. And I don't know if that's work that gets done anywhere.
We do not currently reconcile what was reported to 911 versus how the field responders disposed the call or what they found when they got there. Only because it doesn't change. I can't assume that what you called about is false, right? If you call me and tell me it's what it is, we have to ask the right questions and rely on the honesty of the information gathered.
I totally appreciate that.
If we do that one time wrong, right, we're going to under-respond to something very important.
No, I'm not saying we want to necessarily, we would never want to create that scenario, but
Sure.
I think we would want to understand, like, is the sensation out there that we're not getting responsiveness so strong that 50% or more of our calls are over dramatized, for instance, or something like that.
Sure. It could probably be done. We've not done it. I need to look into how that works.
I appreciate that. And
Sure.
I'd just be curious if other markets have anything similar to that. Just curious about that, because I think it does help. I heard the piece about the kind of spike in non-emergency calls, and if, again, like to understand what is driving that. And so to that end, this is related. I want to share something that just happened in the past week that is on the ground in our neighborhoods, and specifically one of the ones that I represent. One of my neighborhood association presidents just told me that he is telling people not to bother with the non-emergency number and just to call 911, right? And that says that and I heard you talking a little bit about that too, right? I think we don't want to be in that scenario, right?
We don't necessarily, but I can tell you we considered that early on. When we first started talking about limiting the number of people available to answer the non-emergency so we could prioritize 911, that was almost one of the first assumptions. They said, we can't do that because everybody will just call 911. And we looked at the number of calls. We could, and I'm not encouraging the public to do this, please don't, but we could experience a significant increase in 911 call volume without seeing a significant impact to our call response times if we're staffing 911 appropriately. So we've been doing that since October of 2020, and we've seen like I said, 12% increase in or improvement in call answer times from comparable year 2019, assuming that 5% of those people were calling 911 and shouldn't have, then we can move from an 88% to maybe even 92 or 93%. But we've still seen a significant improvement that way. And I've not heard from my dispatchers, who would be the first to tell me, man, I'm taking a lot of non-emergency calls on 911. This is not the case. So most folks are using 911 appropriately. To that end, I would actually encourage, sometimes we have a tendency, I think we may have a public education effort. For 35 years, we put 911 on the side of every public safety response vehicle across the country. And I think we've done such a good job of saying call only when you need it, that there are folks that maybe are hesitant to call it when they need to. The complaints I've heard, just as an example, nobody answered my call when I called non-emergency, and it was two people fighting in a yard, fist fighting in a yard. One woman getting pushed out of a car while was moving down the road. One person, a naked person, I don't know, on my doorstep. All of these situations, I would say, are 911. It's active. There's a life safety concern. There's something happening that time sensitive. We need to know about it, or it could be poor. It could be bad. call 911 in those situations, please. Don't think, well, it's got to be a stabbing, shooting, cardiac arrest, childbirth to qualify. It doesn't have to be.
So I think that might be the next most interesting part of this, because in the incident I shared with your office that I personally witnessed, and my daughter, who was just in here, was actually closer even than I was to being an eyewitness to it. Right, I would have rated it ordinarily as a suspicious activity scenario, right? Here are some people we don't recognize. Oh, they're going into our neighbor's car, coming back out. It's not life-threatening. They were the only ones out there, right? It is very likely a robbery in progress, right, or burglary in progress, or larceny.
Yep.
And what ended up happening was I wound up on hold for more than 20 minutes.
Right.
The call was automatically de-escalated. And so dispatch.
Because of the time, right?
Right, because of time. And so dispatch did not occur until several hours later.
Sure.
Because obviously the suspects were probably no longer near it. That was probably a correct assumption at that point.
Crimes in progress, please call 911, right? If it's time sensitive that says somebody needs to be here now and see it now, that is what that number is for. It is not, like I said, I think as a country, I wouldn't even limit that to Davidson County. I think as a country, we've done such a strong job of reporting 911 is only this, that we need to expand the definition there a little bit. It says if it's time sensitive, call that number that's dedicated for that purpose.
And that may be a part of it, right? I mean, I think it would help me to go back to constituents to say, right, I guess I'd like to go off of the guidance that you all are offering broadly. If there's a one sheet or something that is tailored to communities, coming back to that point of education.
Awesome.
With some examples even, right? I mean, because what you just laid out is absolutely different than the way that I have personally been trying to distinguish between 911, where I have, it's what I have always understood is urgency without emergency that's when you call 8600. And so, to me, this was an urgent matter. It was not an emergent matter, but to your point, it was a crime in progress.
Sure, that's a challenge in our lane. I understand what you're talking about. When I joined the department in March of 2020, and that urgency without emergency concept is a challenge for me because I don't have an almost emergency line. I either have 911 or a non-emergency line. I don't have both. And our challenge for several years of trying to treat both lines as both, right? Well, that one could be emergency too, is what was driving our compliance rates for answering 911 so low. And so we really have to do a better job of kind of re-advertising ourselves to the community to say, we have one emergency number and it's 911 and we staff it intentionally to answer it quickly. Please use it.
Okay. I think putting some on the other side of this meeting and putting some emphasis on that, and I'm sure I feel that, and then just making sure this committee, that we find a way as council members to collaborate, because so often we are also, after first responders, frequently district council members are the second responders, right? Where, hey, this happened, and so that's part of what prompted this meeting.
Sure.
And then to that end, I want to just talk about the follow-up communication real quickly. As I had shared with you, I think in a helpful way, I got a text after reaching through to dispatch, right? And so the text message said, your call has been received. You will receive a follow-up text when an officer has been dispatched. Now, that's a great helpful prompt from the system. I called in from my mobile phone, and so great, I'm in a position where I can receive that. It's, to Councilmember Porterfield's point, not everybody is going to be in the same level of technology. Some people are going to be calling from landlines. But for anybody who can receive that type of follow-up communication, it's very helpful. The problem was I never did get that follow-up text. And so I also want to make sure that the system is intact enough that if an expectation gets set, that expectation is then followed through upon, right? So I don't know if because it was automatically de-escalated, it wasn't dispatched.
In that situation, I recall this one investigating this, so it's computer technology, so allow me to wander through this just briefly. There are certain criteria that trigger. We did dispatch that call. An officer saw it. They did not go en route on their computer. They went from being dispatched to on scene fairly quickly, said, hey, I'm going to take this, I'm nearby, and and when they changed their status to on scene, it never hit that en route requirement. And that en route category is what sends that other text message to you. We don't notify when the officers are on scene. We don't send that text message because there's a safety concern for for officers. We don't want to say, hey, they're out there now, right there, now you can see where they are. So since in that situation, when we skipped the dispatch to the on-scene status, and we had an opportunity to retrain our dispatchers to say, hey, make sure when you're moving, even if they're in an hour en route status for half a second, that we're hitting that status, so we're sending those messages as the system is designed to do.
Got it. So that was basically an episode of a missed trigger.
Correct.
But otherwise.
We skipped the status.
Yeah, okay, got it.
Last question,
Yeah,
Councilman.
thank you. This good timing, because this was my last question. The other thing that has happened to me twice out of the few times that I've recently called in something, right? So another example of an 8600 call I tried to make was when there was a traffic signal out. And I was driving, so I didn't, there was a time-sensitive scenario, and I couldn't easily pull over, use the app on my phone to do a hub report or whatever. Sure. So I used hands-free and called in to dispatch. Well, I was on hold all the way from downtown out to Donaldson and abandoned the call. Sure. Second time this happened in recent weeks, where I can't even remember now. I know the chair wants me off, so I'll say there was another time this happened. I abandoned the call. In that data, are you capturing too how many calls get abandoned?
We don't. I mentioned this earlier, and I understand you were en route. But our call taking software that we currently use is designed for emergency communications call receipt. So the call software does not track how many people call a non-emergency number and hang up, because they recognize that as a non-emergency. We do for 911. We are transitioning to a more consistent call handling process for our administrative lines this fall, which will be more in line with what Hub Nashville uses currently, with what how other 10-digit numbers are handled across Metro, which will give us that visibility. But currently today, I don't have that.
And I will just share with you, again, going back to the data, I must just be somebody who has bad luck with the system if the aggregates look like what they are, because 3 of the last 4 times that I've called have resulted in greater than 15-minute hold times. So
sure, that 10 a to 10 p.m. conversation we were having is very likely. I'll go and pull that data and see what our average answer times are in the daytime, right? Yep. And not looking at those outliers, the weekends, the holidays, the 3 o'clock in the morning, those types of situations.
One of them was on a Sunday, so I'll just share that with you. So
fair enough.
Director Martini, if you'll indulge me, Councilwoman Porterfield has another question before we get back to your presentation.
I'll try to be very brief. In getting that daytime data, please don't forget to get the nighttime data as well. To, I think it was maybe Councilmember Gamble's point, one thing that we've seen, even after like the long response time, and I'm not sure if this question is better suited for MMPD, but after the long response time for a call, then there's the long response time for an officer actually showing up. And I've had instances where constituents, one person, he actually lives in North Nashville, but he had an accident in my district and was calling me each hour because he had been waiting for the police for over 7 hours to come to respond. There was another incident where a neighbor was, all of their work equipment got stolen from their backyard, and it took, I believe it was 12 to 15 hours before the police responded to it. There were no text messages. There was no communication letting them know that the police are on the way. So it's putting people in situations of, do I leave this non-emergency situation and go to work, or take my child to school, or go about my day, like when there's no anticipation as to how long it can be. I definitely understand the safety concerns, but if we could maybe figure out a way to set a better expectation so that people will know when they are contacting, whether that's 911 or non-emergency, because I've actually received complaints with 911 calls as well as 862, 8600 calls. I was looking in my email to find an incident that happened June 2019 that a constituent reached out to me about, where they called 911 because someone was actually in their home. They were knocking on their door between 2 and 3 in the morning. They opened the door thinking it was the neighbor. The person entered their home and would not leave, and they called 911 and no one ever came. So the experiences that you are sharing with us sound amazing, and I wish that they more closely aligned with the lived experiences of our constituents, but there is a discrepancy somewhere.
Sure.
So
I definitely can't speak to June of 2019. I joined in March of 2020, and we've been very focused on making some great improvements since then, but what happened prior to my arrival, I don't know. And we're definitely partnering with the police department in a variety of conversations about exactly this, right? How do we leverage the technology that exists to provide those alternate means for reporting so people don't sit for forever, right? Whether that's a crash report or something else. And then how do we give an expectation of where is my response and how long am I going to stay here? I think we get it when we were handed the red buzzer at the restaurant. How long is it till my table's ready? We have that expectation, and there's some opportunities maybe to bring that into public safety response.
Yeah, and I think there's a fair expectation that if I call the police, I'm not going to wait online 30 minutes or I'm not going to wait for 3 or 4 hours. Like, our tax dollars go to fund these programs. People want to see results. They don't want excuses. My last question is, could you share with us very tangible steps and a plan to decrease the 862-8600 wait time over the next 3 months?
Absolutely.
You're going to share that today?
Ma'am.
Okay, thank you.
Those are my next slides.
All right.
I appreciate it.
Thank you.
Are there any other questions waiting?
No, you're good.
Fantastic.
Thank you.
So we've talked about what we've done. Right. What are we doing? One of those is, again, implementing those 911, 311, the conversation we had here with Councilmember Withers about cars parked in bike lanes, those types of things. There are a variety of opportunities, options that can be reported through Hub Nashville. And if we can move those who are willing to use that reporting method to an alternate, whether it's a website, whether it's the smartphone app, to make those reports and free up our call lines or our phone lines for those who are dependent, relying on the phone call to make those reports. That's, again, reduce the ringing call volume, reduce the people in front of you in line, and get your call answered quicker. And that's happening now. We are actively recruiting, so friends, family, neighbors, countrymen, those who are interested in working with us, we are actively recruiting for 40 new positions that were approved by council in July with an intent to have those onboarded and ready to go, teaching those primarily and initially as call takers in October, which will definitely help. We'll take those 40 people, spread them out across really our 10A to 10P, right, and maybe even special shifts that we can assess or adjust based on call volume that are really focusing on answering those calls in our heaviest call volume. We are actively working with Vanderbilt and Metro ITS. We received earlier, I think it was last week. This is not, there's a larger public release effort coming later, but in October, but we have received a $50,000 planning grant through the National Science Foundation for a artificial intelligence solution that would process low priority calls when you call. That opportunity that says, and it sounds like a Siri or an Alexa type voice that says, what are you reporting? I lost my wallet. And then it says, what's your name? What's your phone number? And the call is going to be processed as though you spoke to an actual person without actually tying up a dispatcher in the process. So a $50,000 planning grant was awarded to our team in last week, and we've got 6 months to develop our plan for that in February for an opportunity to receive the $1 million implementation grant, which would also be a very tangible way of how do I report, how do I get this handled quickly without waiting. So Hub as an option, utilizing some AI, and this is not something that's completely, it's pretty leading edge. Austin Police Department in Texas is exploring this. Charleston, South Carolina is exploring this with Amazon Web Services. So it's not bleeding edge, but it's pretty front burner in how communication centers are trying to leverage that non-emergency call volume. To stress in that conversation, this is not using AI to process 911 calls or emergency calls in any way, shape, or form. It is those low priority, low acuity calls that can be processed with, this happened and I just need to let somebody know about it, so that our folks can stay focused on 911. We are exploring alternate scheduling. That is something actively happening inside of our center now. We're assessing the financial viability of a 12-hour shift, or maybe some combination of 8 and 12-hour shift, to put more people on duty in overlap times, which would obviously create higher call volumes, assuming that folks are present for their entire shift, that they are there. So we're looking for those options that would be implemented in spring, typically, which is February or so, when we make shift changes. So we're putting that to a vote to the group as part of, I would assume by October, because we need to have all that stuff in place by December to make those changes. We are regularly involved with a variety of national, national, international organizations, one of those being the Association of Public Safety Communications Officials, the State Emergency Communications Board, the State Emergency Number Association, as well as the National Association that sets those best practices and standards. We're very involved. Several of our team members either serve on those boards or are actively involved with training that material that helps us understand what is the best way to provide the service that we're asked to provide. And we continue to be engaged with those conversations. Hopefully some of those answer your question, and I'm willing to get more in detail if they did not.
Do you have more slides? I'm sorry.
No, ma'am.
Oh, okay. Thank you. So I think one of the, kind of referencing the organizations that you're a part of.
Yes.
Can you talk a little bit more about that transition to APCO? Because I understand it seems like the implementation, I guess, is taking a very long time.
Yes.
And that there's some IT challenges that, are impacting
Actually,
how calls are answered and the ability to be able to be responsive if you're a call taker.
Sure. We migrated from a solution that was provided by, let's see, trying to think of their name. It's the product is ProQA. The solution comes from the International Academy of Emergency Dispatch. That transition was requested not only by the medical director, but also by the fire department early on in my time with in my role in the department. It's a cumbersome protocol-based solution that basically feels like walking into your doctor's office and they hand you the clipboard and say, answer all these questions before you're led back to see the doctor. That led to a user experience that says, I have to basically fill out this entire clipboard to explain to you I'm having a heart attack, and that was frustrating. So we shifted to a call guide approach rather than a call protocol that says these are the general questions you're going to ask of these types of calls. We went to that solution in August of 2021 with the anticipation of installing that providers. There's really only two providers out there, International Academy of Emergency Dispatch and then APCO's IntelliComm solution. We went to APCO's IntelliComm solution. What held it up was not a technology issue. Actually, it was the legal negotiations, probably the longest I've ever seen. 9 months of legal negotiation over contracts back and forth over who was responsible for what. We're finally complete with that process. It is in the late stages of testing with our technology folks to make sure the questions are presenting in an organized manner. In the meantime, we aren't running without protocols. We're using a solution that has all of the questions and instructions that you would give for a relevant call on PDFs that are saved at the position and referenced by the call taker when they call in. I would agree that is not the primary way we want to do business, but it is it would serve and continues to serve as our backup solution for how we operate when our solution's in place that we expect to have this fall, and rather than nothing at all. If there were some issue with that software, we'd still have those PDFs to fall back to ask the right questions and give the right instructions.
So the PDFs will go away after the full implementation?
No, the PDFs stay as our backup. They just won't be our primary reference.
Oh, okay. And so, and kind of talking about that, I guess, really related to the training side of how call takers are trained. I understand, and correct me if I'm wrong, that there's been some transition from the amount of classroom time somebody has before they're on the floor versus maybe how we're handling it today, and that people may be on the floor a little bit faster, but don't necessarily have all the skills built before they get to that point. So can you speak a little bit to maybe clarify my understanding or?
Yep, we cut a week of classroom training out of the process to onboard folks onto the floor because that classroom training was simulated training, learning how to enter addresses and code types and those things at a console in a simulated environment. Honestly, we weren't seeing a significant improvement one way or the other, rather than just putting them on the floor with a trainer at their side doing those same skills at the console. So our trainers are adapting to maybe not having a trainee that has entered an address into the CAD system before, done some of those things prior, but they're going to spend the next 3 months on the dispatch floor with a trainer side by side, navigating that same console. So we just moved away from the teaching that in the classroom environment to doing that as part of the on-the-job training.
And how do you feel like that's impacted the quality of the call takers that you have? That's a pretty big step to take away a week's worth of classroom training. I disagree with the statement of taking it away. We just migrated it right from inside a classroom and simulation to on the job with a trainer attached to their hip. We have not seen anything inside of our quality assurance efforts that are reviewed every week. We do probably 2,000 quality assurance assessments a month, and we're not seeing any dip in the quality of the work that's being done by those dispatchers. And certainly the CTOs, when you're in training, we're not waiting for somebody to catch a call once a month. There's extensive observation and feedback by that trainer every day in that 8 hours. So we're not seeing any trainees fall through the cracks in this process so far because of that I'm aware of. Okay, let me catch up with Councilwoman Porterfield here. Sure.
What are you seeing with regards to retention rates? I would imagine this is a very high-stress environment based on the nature of the calls, and if you marry that with the aggravation of the constituents from waiting such a long time to reach a person, I would imagine that the dispatchers are under a lot of stress and pressure. So what are we seeing with regards to their retention rates?
Sure, I appreciate you asking that. We are at an annual, about every year for the last 16 years, we've seen 29 to 30 people leave in a given year for a variety of reasons. So far, through middle of August, we've had 25 resignations, and looking at those, the majority of those are individuals who accepted other positions, other jobs, career mostly around shift work. They got opportunities that did not require them to work nights, weekends, holidays, those types of things, or they moved out of state to be closer to family, whether to be a caregiver or to be closer to immediate family. So our retention rates and our turnover rates are consistent with what they have been for the last 16 years. I know what you're talking about, and that's important to me that we have as much fun as possible in an environment where there's not a whole lot of fun. But I know there's some examples out there in the private sectors, whether it's a Dell call center or Maytag or whatever that may be, call centers designed to take complaints around this broke, that broke, that are very positive, high energy environments. So we're trying to borrow some of those lessons learned from those environments and apply them in our space so that we don't experience what you're talking about. For those that experience something traumatic, whether it's and I hate to say traumatic, in our environment, when you say an officer-involved shooting, we can have those multiple times in a week in the size community we serve. Where you talk about a smaller community, they have an officer-involved shooting. It's one of those or two of those a year. So that dispatcher would say that's a traumatic experience. But so that high-profile, what do we say? High priority, low frequency type call. We do have immediate critical incident stress debrief opportunities available for those involved. We also have longer term support, whether it's through the employee assistance program for all Metro employees or a specific employee assistance program that's offered to public safety professionals. And we either offer that to those who need it or require it if we see an impact to performance.
Thank you for that. And just a bit of a clarifying follow-up question. And I worked in a call center, so if you have any questions about some incentives, I can talk to you about some great ways that we provided opportunities for the employees there. But you said about 25 to 30 people per year, and that's based on how many employees total?
191 authorized positions today. That's not including the 40 that we were just authorized in July. So right, 10%
okay,
or so.
Okay. And then 30 out of 191, 10% would be 19, a little more, 15% maybe, a little more, 15%. Yeah, but not too terrible. The other follow-up, I just drew a blank. It was based on vacancies. Are y'all fully staffed, or is there how are your vacancies looking right now?
Sure, we are 3% vacant. We had 29 individuals lined up to fill 20 vacant positions, and through the process, whether they disqualified for background checks or physicals or whatnot, we went from 29 to 14. We started those 14 Monday of this week, so with those 14 on board, we have 6 vacancies, so 3% vacant currently.
Thank you. My last question. Thank you, Madam Chair, for indulging me. My last question, with the new 40 positions that are allotted to you all, do you all see a drastic, see that will drastically improve the call time as well?
Absolutely. That just comes back to, you showed that I'm an English literature major for a reason with my 15% versus 10%, but that ratio conversation, it really is just a math problem, right? That 1 to 9 is what it is. And we say 1 to 13, 1 to 15, 1 to 18, and as the calls increase, if I put more people on the floor, that draws that calls per available person to answer the phone down, and we see that compliance rate goes up. So yes, absolutely.
Thank you.
Thank you.
I want to go back to something Councilwoman Porterfield was asking about, support for employees that are taking calls, because I would contend that this is probably one of the most traumatic jobs that we probably have at Metro government, because you don't get the resolution to know really what happened and how you impacted somebody. It's kind of more rare than other opportunities that we have at Metro government. So if somebody has a traumatic call that is troubling for them, can you, other than referring to them to the EAP and some of those pieces, can you describe what exactly happens and how you support that employee right after they hang up the phone?
Sure, immediately, right. They can seek assistance from any supervisor on duty if they say, hey, this is a problem and it's an issue for me. We have quiet spaces inside of the comm center. Folks can go and rest to take a moment from that. If they say, I need up to take a lap, it's important to go outside and breathe oxygen in those situations. If you work the middle of the day, it's important to go outside and put a little sunshine in your face in those moments. So we definitely do have those immediate responses to those folks and say, I just need a second from what I just experienced. I need to walk away from it and come back. The critical incident stress debriefs are available for the larger incidents. EAPs available, right? Those opportunities for folks to follow up. We do attract a unique subsection of the population. You're right. We live in an environment where we take so many phone calls, and I did it for 5 or 6 years in the city of Chattanooga, so I know firsthand what we're talking about here. These calls where you take 80 to 100 calls in an 8-hour shift, and after a week somebody says, you took this call, that was your experience, and your reaction is, oh yeah, I took that. It wasn't one I heard somebody took. It wasn't because it's just an overwhelming. And if you find out what happens to 2 of those 100 in a day, that's big feedback, right? You just hang up and you move on to the next call. So it's definitely part of one of the dynamics that we test for in pre-employment testing, and we're looking for those types of personalities that would excel in our environment.
Thank you for that. And Councilman O'Connell is here in the room, so I'll ask this question that I did get, which was, is there a bat phone from downtown bars or anything like that into non-emergency 911?
No, ma'am.
There's no special way for, if I own any of the bars, that I can call in and get a quick response?
No, ma'am.
Okay. Right,
everybody's equal in 911 for better or worse. It doesn't matter.
Go ahead, Councilwoman Porterfield.
But as a follow-up to that, if one precinct does not have, are the precincts, and this may be a question for Commander Sergeant Gilder, Representative Gilder, my apologies, I can't remember your title, but I don't believe all of our precincts are staffed at the same level, correct? So if the precinct that handles downtown has more officers on duty than, let's say, the Hermitage precinct, which covers a huge area, then the wait time would be longer in the communities for the precincts that are not staffed at the same rate. Is that correct? Am I understanding that correctly?
Yes, ma'am. It's Commander Gilder. Yes, ma'am. So what we do is we run a model twice a year. And we look at calls for service, we look at geographical area, boundaries and whatnot, and then we allocate, each year we have a rebid, and we will make adjustments as needed based on that data. So you're correct. Central precincts, I forget, the 4, 5, 6 square miles at most. It's certainly staffed at a much lower level than, for instance, Hermitage Precinct, which is a bigger swath of area, experiences more calls. They're staffed accordingly based on those metrics.
Is that data you can share out with the council? The staffing levels?
Yes, absolutely. Yeah.
Okay. All right, thank you.
Yes.
All right, thank you. How about any other questions from the floor? We got Councilman O'Connell. Oh, hang on one second.
Thank you, Madam Chair. I will say I just became aware recently of, this is to some clarification to your point, which may or may not yield refinements to the answer, but there is a, Hub Nashville does have an entertainment district safety concerns request type. And so while I'm not going to be able to speak to anything about how the responsiveness to that works, but there is also a QR code that has been distributed, and so there are. The answer is a little more subtle, I suspect, than just a no. There is not, because there is this. It's available to the public, but requests are routed to DC for dispatch, and so they, it shows up in the data through that.
Yep, that is specific to those initiatives that happen typically Thursday through Sunday night when special task forces are assigned. We saw that really prevalent right through the pandemic, and obviously it continues. But if there's a concern about, again, for the longest it was mask enforcement in the area and those types of things, but we're also using it to monitor tampered drinks, those types of things. If somebody says this happened in this area, there are additional officers, not patrol officers, but those assigned to a special task force for that purpose. And we can observe those and dispatch those out quickly to the dispatcher that is working that specific special event that night. They can monitor it, see it quickly, get it to the resources in the area.
Did you have something else, Councilman O'Connell?
Something unrelated to that.
Oh, okay, go ahead.
Sure, thank you. And this is kind of coming back again, the interaction by text also made me wonder. I know the FCC a couple of years ago put out guidance on text to 911. Is that something that is being explored by DEC at this point?
We have been live with text to 911 in Davidson County since shortly following the Christmas pause, so January of 2021. We received somewhere around 100 text messages per month from citizens. It's not that of those 100, we're seeing 30% maybe be something that you would expect to be a text to 911, some sort of somebody's in my house, or I can't speak, but I need to contact. There's, I need this person to leave, those types of situations. We have not publicized that broadly, primarily because of our media footprint. If we say it in Davidson County, it'll be broadcast in Bowling Green, Kentucky, and further south. And text to 911 is deployed not only at a micro level, not just at a county level, but at a city level. We would cause a massive heartache for our neighbors if we said, you can text 911, because folks may not pay attention to where that happens, and say, for example, to the flip side of 8600, when we shifted from a call 8600 message to a call 311 message, I received a phone call from our neighbors to the south that says, I have a resident here in Brentwood that called 311 and it didn't do anything, right? They were told to. Well, that was an 8600 number we were receiving before that really didn't belong to us. It belonged to that city. We shouldn't have answered that. We were receiving 8600 phone calls from Bowling Green and from neighboring counties, because the radio where they were driving heard they said call 8600, and so they called it because it's the non-emergency number you call, right? So there's probably a significant reduction in calls we took just by not taking our neighboring counties' calls. So it's how we advertise the text to 911. And really the preferred, I apologize to go on about this, but the recommended way from the National Emergency Number Association, the messaging is call if you can, text if you can't. I don't necessarily support an advertising campaign telling people not to do something, right? If I don't want you to do it, I'll just keep it to myself. Word of mouth is out. Obviously, we're receiving 100 text messages a month. People know it's available, and it continues to grow.
Okay, thank you.
Thank you.
I'm going to take Councilwoman Porterfield, and then we'll wrap up since we're well past time.
Thank you for indulging me, Madam Chair. One more question with regards to you all addressing the hub complaints. Are you all also responsible for closing out those complaints? Because, and I ask that because another complaint that we frequently get from constituents is when they are putting complaints into the hub, they are closed out before they are actually addressed.
Sure.
So that's something that's very prevalent. So are you all the ones that are doing that, or is it coming from somewhere else?
We can be if it's a public safety response. That adjustment that I'm talking about started, we've been doing that for now 3 months, really, of issuing, here's the report number for the incident that was dispatched if you want follow-up. The challenge is, and it's not an ongoing challenge, we're continuing to look at how this might work. The software solution that is used that we use, and then the separate software solution that the police department uses to track their reports is different from Salesforce, which was the driving brain behind Hub Nashville. So we don't have currently a connection between those softwares that say the solution that it was determined here is going to get fed back through that process to inform the caller. So the best solution we have today is just saying, here's the number you need to use when asking how did this resolve, because we were experiencing exactly that. We dispatched it out to the responders, and that's what the citizens were being told is, thanks for telling us we dispatched somebody. And their obvious reaction is, then what? What happened from that? I think there's opportunities to explore interfaces between those software solutions that may give additional data, so we're not having disparities between, but that's going to be an ongoing discussion, conversation, cost, all that stuff that comes in the conversation.
Thank you.
Thank you.
One thing as we wrap up that we haven't even really touched on is I think that kind of like other departments that we're continuing to put a lot of burden on your department, in particular related to the Partners in Care co-response and the upcoming non-MNPD response model. And so I think I won't be chair after today. For the next, we're changing chairs in September, and so I think it'd be really good for the next chair to hopefully watch this meeting if they weren't here in person, and then and really think through kind of what are the opportunities kind of that you've spoken about as far as potential interface improvements and training and everything else, but really being cognizant of what else are we adding to your plate, because that I know we've done it to schools. We do it to a lot of different departments that are really good. We add a lot more burden on top of people's original responsibilities. So that would just be my recommendation for the future chair to think through, because I think a lot of the things that you discussed are really great to see. And if you came back to a future meeting and you were talking about we changed the phone number or we changed the outgoing message and it's shorter and we're redirecting to 311. I mean, I think that'd be a tremendous kind of boost in confidence for users. So and also improving that resident experience as they're calling in and visitor experience. Absolutely. Since we're hearing from visitors as well. So I really appreciate your time today. Thank you very much for the informative presentation and for taking all of our calls. And with no further questions from anybody else, we're adjourned.
Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.